Right. My name is Eduardo Bruera. I am the chair of the Department of Palliative Care, Rehabilitation, and Integrative Medicine at MD Anderson Cancer Center in Houston. And I have worked in this area of palliative care for about 30 years in developed and developing countries in different continents and over time. The opportunities to improve palliative care are clearly related to our ability to help primary care doctors and nurses working in the community to measure very simple physical and emotional symptoms in the patients and their families, and to have very simple strategies to help alleviate that physical and emotional distress at the very primary care level, and also to help them detect when the patients are not improving enough, so that then those limited number of patients who do not improve to my very simple management need to be referred to more specialist programs. The challenge at the system level, at the healthcare system level, is to, on one hand, provide those healthcare professionals with a very simple education on how to deliver the care, since most medical and nursing schools unfortunately do not educate on palliative care. And also the system needs to make the available secondary services, the ones that are specialized for those patients who do not improve. In fact, by creating those specialty services, the governments will do two things. On one hand, allow those difficult patients to be treated, but also will have the teachers, the ones who will educate the primary care doctors and nurses. So they will be accomplishing two goals in one single measure. To me, the main obstacles are the lack of understanding by healthcare authorities, private and public, that palliative care is absolutely unique in healthcare, in that providing more palliative care provides enormous money savings. In orthopedics, savings in money would mean less hip surgeries. In cardiology, it might mean less pacemakers. In palliative care, what it means is, by providing that extra layer of care, that patient will not get unnecessary chemotherapy, unnecessary hospitalizations, unnecessary ICU, unnecessary heart, lung, or other treatments that are very, very expensive. So providing palliative care prevents patients from accessing unnecessary and very expensive interventions, and the lack of understanding of that saving is what is being the main barrier in governments and insurers from really investing. Right now, those that are private insurance systems, ironically, are the ones who have understood that. That's why right now, most of the world, the leading forces in investing in palliative care are private insurers who have learned that they will save a lot of money and make a lot of profit by having palliative care being rapidly developed. So our governments and our healthcare systems can benefit from understanding this, and that will remove the main barrier for global palliative care access. One of the things I have learned is that the alleviation of physical and emotional suffering is one of the most rewarding ways in which we can practice as doctors, nurses, and other healthcare professionals. So it can be an enormously rewarding way of treating patients and families. I have also learned that to do this, we need some training, because we get exposed daily to human suffering. And therefore, it's very important to get the appropriate education for doctors and nurses about how to relieve that suffering, so that then they can have the enormous gratification of making that suffering go away without becoming burned out by the process. We know that in the times of Marie Curie, without appropriate protection, a lot of the radiation therapists died of radiation injury. Nowadays, radiation treatment is provided technically much better and with no radiation injury. In the management of physical and emotional suffering, it's the same challenge. When we know very well how to do it, then we do it better and there is no burnout. What we are taught as doctors, nurses, and pharmacists is that somebody has a tumor in the liver with metastasis in the bones and has low hemoglobin. In palliative care, that same person is now working in a bar, has 3 children, has dreams, aspirations, and losses that are experienced as a consequence of that tumor. And that gives us the opportunity to bring relief in a dramatically different way that can be very rewarding to healthcare professionals. It just requires us to learn how to ask those questions, learn what to say, and learn a very simple group of medicines that can help us relieve all that suffering. And now it can become humanized and it can become very rewarding. The main lesson for the policymakers is please invest in educating your doctors, nurses, pharmacists in the delivery of palliative care because you are going to improve the well-being of the population and you're going to save millions of your own currency. Call it dollars, pesos, or whatever your local currency is. This is a very unique aspect of healthcare that is going to make your population happy and is going to make you look good and is going to save you a huge amount of money.